Welcome to Organic Awakening. We all know that high blood pressure can harm our health. For many, it increases the risk of serious conditions such as heart disease, strokes, and kidney diseases. To help mitigate these risks, doctors often prescribe medications to bring blood pressure down to safe levels. According to general medical standards, an optimal blood pressure reading is 120 over 80 millimeters of mercury. But here's something to think about. Have you ever wondered if these values apply to older adults? With age, the risk of developing high blood pressure increases. This condition often runs in families, hinting at a genetic predisposition. Even without a family history, living long enough can expose you to this risk. If you're over 65 and dealing with hypertension, you might already be on medication and wondering, what should my target blood pressure be at this stage of life? In today's video, Organic Awakening dives deep into ideal blood pressure levels for older adults. We'll discuss the benefits of managing blood pressure effectively and weigh those against the risks of intensive treatments tailored for this age group. If you find this video insightful, give it a thumbs up and join our growing community by subscribing for more natural health insights. Your health journey starts here. The standards for diagnosing and managing hypertension have significantly changed. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, issued new guidelines that revised previous criteria. These guidelines lowered the threshold for diagnosing hypertension, defining blood pressure of 130 over 80 millimeters of mercury or higher as elevated for all individuals. Previously, the threshold was 140 over 90 millimeters of mercury for those under 65 and 150 over 80 millimeters of mercury for individuals over 65. Under current standards, normal blood pressure is below 120 over 80 millimeters of mercury. Elevated blood pressure is defined as systolic values between 120 and 129 millimeters of mercury and diastolic values below 80 millimeters of mercury. Stage 1 hypertension is characterized by systolic pressure between 130 and 139 millimeters of mercury or diastolic pressure between 80 and 89 millimeters of mercury. Stage 2 hypertension involves systolic pressure of 140 millimeters of mercury or higher or diastolic pressure of 90 millimeters of mercury or higher. What does this mean for older adults? For seniors, it's crucial to monitor blood pressure closely. A systolic value of 140 millimeters of mercury, previously considered normal for this age group, is now classified as hypertension under the new standards. One pivotal study leading to these revisions was the Systolic Blood Pressure Intervention Trial, or SPRINT. Published in 2015, the study examined the impact of stricter blood pressure control on cardiovascular events and mortality in individuals at high cardiovascular risk but without diabetes. Notably, it excluded patients with dementia or those who had experienced a prior stroke. The SPRINT trial included 9,300 participants aged 50 and older, with an average age of 68. Participants were randomly assigned to one of two groups, a standard care group with a systolic blood pressure target below 140 millimeters of mercury, and an intensive treatment group aiming for systolic pressure below 120 millimeters of mercury. Over 3 years, researchers meticulously tracked the groups to assess side effects, chronic diseases, cardiac issues, and mortality rates. The results were significant. Annually, 2.19% of participants in the standard treatment group experienced severe cardiovascular events, compared to 1.65% in the intensive treatment group. While the intensive approach reduced cardiovascular risks, it was not without drawbacks. Participants in this group had a higher incidence of adverse effects, including abnormally low blood pressure, electrolyte imbalances, and acute kidney injuries. These findings suggest that while aggressive blood pressure management can lower cardiovascular risks, it may also increase the likelihood of other major health issues, particularly in older adults. Another noteworthy study was the 2021 China RCT, which compared intensive versus conventional blood pressure control in nearly 20,000 Chinese individuals aged 60 to 80. The study revealed that targeting systolic blood pressure below 130 millimeters of mercury significantly reduced the risk of severe cardiovascular events, including strokes and heart attacks. Stroke risk and blood pressure management. Compared to maintaining blood pressure below 150 millimeters of mercury, as studied in the SPRINT trial, intensive treatment has been associated with a higher rate of adverse effects, such as hypertension and kidney damage. However, it has also been linked to reduced all-cause mortality. What should your blood pressure goal be? Many clinicians advocate a more individualized approach, treating each patient based on their medical history and overall health condition. Although studies like SPRINT suggest that achieving a systolic blood pressure of 120 millimeters of mercury may be beneficial, this often requires multiple medications, which can lead to unpleasant side effects. Managing these side effects, especially those caused by low blood pressure, is crucial. This is particularly important for older individuals who may be more susceptible to the dangers of intensive treatment. Frail elderly patients or those with multiple health issues may benefit from a more conservative blood pressure goal. Aiming for a systolic pressure below 140 or 150 millimeters of mercury can strike a better balance between reducing cardiovascular risks and avoiding potential harm, such as falls caused by hypotension. Blood pressure and aging. High blood pressure is a normal part of aging due to physiological factors such as the loss of elasticity in blood vessels, hormonal changes, and kidney function abnormalities. Over time, arteries become stiffer, and hormonal fluctuations affect how the body regulates blood pressure. These changes highlight why a normal blood pressure varies significantly from one individual to another. This diversity underscores the importance of discussing your unique needs with your healthcare provider rather than following new guidelines blindly. Your doctor can recommend the best course of action based on your overall health, existing medical conditions, and current medications. Personalized blood pressure management. Maintaining a blood pressure of 120 millimeters of mercury is not necessary or beneficial for everyone. Some individuals may find that the mental, physical, and emotional costs, along with the side effects of heavy medication, outweigh the benefits. However, this does not mean you should allow your blood pressure to rise unchecked. If your systolic pressure exceeds 160 millimeters of mercury, or your diastolic pressure surpasses 100 millimeters of mercury, it is generally advisable to consult a doctor to lower these levels as soon as possible. Conclusion. Every individual's health situation is unique. Collaborating closely with a doctor who knows your medical history and can tailor advice to your needs is essential. Their professional judgment based on your personal circumstances is more valuable than general guidelines. Thank you for watching this video. If you found it helpful, give it a thumbs up and consider subscribing to our channel for more health and wellness content.